All right, guys, thank you for joining us for episode 187 of the Crisis Jam CIT in Action. Those of you who joined a little bit early got to see a sneak peek of the over 1,800 people who are in that conference. And as Paul just mentioned, it's a great way to get folks together and talk about how we can be partners, because there's a role for everyone in creating the ideal crisis continuum. So very excited to go back to Paul. A little bit about the 988 learning community, the Crisis Jam. If you're not familiar, you can go to talk.crisisnow.com where you can register for the jam. Again, you need a unique link to get in. So send your colleagues to this page. Please don't forward them your invitation. You can rewatch old episodes, the entire episode on YouTube or embedded there. Or perhaps you're looking for a previous segment. It's broken out into the various ways to make it easy for you to find information. So much good information happening every week. We want to make sure that you can get to it. So again, it's talk.crisisnow.com. And again, I mentioned it for those who joined us a little early. David put out the call for us to get over 1 million views on Moving America's Soul on suicide. You all did that work. On Monday, we crossed over the 1 million views. So just thank you, appreciate it. And again, please continue to share this message, so impactful. And the link to the full film is in the chat. So mark your calendars, guys. This is one I'm really excited about. Vibrant and SAMHSA have partnered with everyone across the mental health spectrum to mark 9/8 Day. So that is September 8th. And we are going to call that 988 Day. The theme there is no judgment, just help. We'll hear a little bit more about that from the SAMHSA update, but please reach out if you want to be an official partner. Looking forward to sharing more information and just seeing, everyone uplifting 9/8 on 9/8, or I should say 988 on 9/8. So with that, we have our crisis hot seat. And again, since we are live streaming at the CIT conference, we're going to do it a little different. We're going to bring Paul back and we are going to have him share a little bit, and then we'll hop into the question.
All right, Laura, look, I'm here live at the CIT International Conference right now with 1,800 family members that are committed to make a difference in this community. Lucky enough to have Sam Cochran here as I see this 1987 CIT is born. And so I'm hoping the group here in the room is going to confidently shout out the correct answer so we don't miss this together. And ideally, Rick, if we could just pan the room very quickly again and go on the camera and let everybody see who's here present with us. We'd appreciate it while we get the question. Thanks, Laura.
Awesome. Well, we'll take a look at the room again and tee you up for this question. It's a little tricky. I actually missed this one. So listen up, room, because we need your help. This one is from the Vault, and it is, which of the following is not a premise of the original vision of the Crisis Intervention Teams, or CIT? Is it A, 911 dispatches closest CIT officer to the scene? Is it B, certification of CIT officers via a 40-hour training? C, dedicated crisis receiving drop-off centers? Or D, voluntary assignment of a percentage of the law enforcement force to a CIT team? So again, please put if you are participating virtual, please put your suggestions in the chat. But otherwise, we are going to hear from Paul and the team at a CIT conference to see what they think is not an original premise.
And Rick, if I could I ask you to click one of those boxes for us so that we can see the question in the room? Pick anyone, Rick. No, we want that to go away. Just close it, please. There we go. Perfect. So everybody, we need the answer to the following. Which of the following is not a premise of the original vision of the crisis intervention team? Which Sam is in the room, I think. He might be a good one to lean on. A, 911 dispatches closest CIT officer to the scene. B, certification of CIT officers via 40-hour training. C, dedicated crisis receiving drop-in centers. Or D, voluntary assignment of percentage of force to CIT. What's the answer, team? Please shout it out. Say C. I hear D. Online, they are saying C. Dedicated crisis drop-off centers. What do we think, team? Let's do a show. I see lots of C that is being held up here. Who says A? B, C. The team here is saying C, Laura. So our answer is C.
Okay, thank you, Paul. That is matching the audience that is participating virtually. This was a tough one, guys. The answer was B.
Oh, look at that.
Of CIT officers via 40-hour trainings. So the key word here was certification. Thousands of communities have created CIT to equip law enforcement to de-escalate and for crisis intervention services. Statewide programs have focused on a standard training, but not certification. So again, this was tricky. It tricked us up when we hosted this from way back when, and it tripped us up again this time, guys. Never fear, though. We've got a new one. Congratulations, Leanne. That was a tricky one. So, Paul, the new question is, the first CIT International Conference marked the beginning of an annual gathering for law enforcement, mental health professionals, advocates, and family members. Which of the following cities hosted the inaugural CIT International Conference in 2005? A, Columbus, Ohio. B, Memphis, Tennessee. C, Orlando, Florida. Or D, Atlanta, Georgia. Did I say Atlanta, Florida? Orlando, Florida.
So I am getting a remarkable amount of people signaling that is A, even though intuition would say B, the home of Sam Cochran. Sounds like we're going to say Columbus, Ohio here.
Final answer? Okay, the audience is split between A and B. You guys got it. Congratulations. Columbus was the first location, and the Ohio Supreme Court Justice Evelyn Lundberg Stratton secured funding from BJA, which I'm not familiar with, to host the very first CIT International Conference. Over 700 leaders from 41 states, DC, and Canada participated.
Laura, I assume each of us get a 988 shirt. Do you want me to gather the sizes? How do I do that?
That's right. And we'll send the bill right to David.
Thank you.
Thank you. And thank the audience there. You guys have been wonderful. We'll come back to you. But let me just talk a little bit about Columbus, and I'm going to wax on poetically because this is my hometown. Next year, it will be 20 years since the first CIT conference in Columbus. So we're bringing it full circle. And the city's new crisis care center will be open. So it is projected to serve over 20,000 people in its first year. Congratulations to the state of Ohio, to the people of Columbus. You all are doing great work. And just down the I-70, there's a great conference happening there in Indianapolis with CIT. We'll come back to Paul and the team there, but let's move forward in this jam. So wanted to highlight an HBO movie. This is our original series. This is actually, again, from 2019, and the link is in the chat. And this is Ernie and Joe, Crisis Cops, and it follows, this is a documentary, so it's not a scripted show, two individuals who work on crisis intervention teams. So I have not watched this, but I've heard it is great. And of course, we have a post here from Ernest, who was actually profiled in this documentary, saying he is looking forward to the event. And he remembers his very first conference back in Columbus almost 20 years ago. Looking forward to that. And so with that, it is my pleasure to introduce Michelle Saunders, who will be our featured presentation for CIT in Action. Michelle, I'll turn it over to you.
Okay, thank you so much, Laura. I really, really appreciate it. And, it's really with great pleasure because I come to you all from the CIT International Conference. I've been here for the last 3 days. It is winding down, but the excitement of 1,800 people in attendance that have come together to talk about CIT programs, to learn, to share, to network and bring more and more people into this wonderful CIT family has just been very, very exciting. As I was thinking about this talk today, when I was asked to do an additional talk on CIT, first I was inspired by several folks that were at our conference who spoke so eloquently about CIT and what it means to them, and that CIT really does matter. But when we talk about CIT as a community program, for many, it may be difficult to conceptualize what it looks like. Oftentimes we think of the training aspect, which is more tangible and easier to think through, but oftentimes the program aspect itself may feel a little bit more difficult to sort of say, what does that look like, when it's really happening, when a program really is a program and making a difference in the community. So I wanted to talk about what CIT in action looks like. And actually, when I first put this together, can I speak, Laura? Can you hear me?
We can hear you. Go ahead, Michelle. Thank you.
Okay, sorry. Thank you. Okay. So it was actually before the conference. So now that the conference is underway, I thought really the first and foremost best example of CIT in action is the conference, because of all these people coming together to really want to make a difference for their community. So they are taking action to learn, to grow, to share, to go home and do good work. So that's really exciting. The other thing that's exciting that this conference has done, and what I believe is one of the powers of CIT, is we've really expanded into our international communities and partnerships. And this year we have Canada. Of course, we've had Canada with us several conferences, which is wonderful. They're our close neighbors. But we've welcomed Guam, the Northern Mariana Islands, Spain, and Spain has making a commitment, and they're presenting to their king and queen on CIT and bringing CIT to Spain. And really, to our hearts and to our honor, Ukraine came to our conference with a delegation so they can learn how to do some best practices around crisis response as they're working through their struggles and their difficulties within their own country. So it was very, very exciting. And to me, again, those are things that speak to CIT in action. What I'd like to do is start with a story. I'd like to bring it home a little bit for me, the Florida story, because I think our story does illustrate taking the concept of CIT and making it into something that's making a difference. It started for us back in 1998, so 10 years after CIT was developed in Memphis. I worked for a mental health center. Actually, please go back a slide and I'll have you advance. I'll just keep it here for a moment. So in 1998, I was working for the Community Mental Health Center, and because of funding cuts, we were closing our mobile crisis services. And people were thinking, why would you do that? But we had several funding cuts, and that was one program they decided to cut. I happened to be in a meeting where I was sitting next to a public defender, and she happened to slide a magazine next to me and said, "Have you heard about CIT?" And I said, "No, I haven't." And there was an article. That was my first foray into learning about what CIT was. And that actually was the day that really launched my mission and journey into CIT. So I was already meeting with law enforcement and NAMI and others around just some of our local issues. So I brought it to our group. As a team, we actually went to Memphis and we learned from Sam, Randy DuPont, and several other dedicated law enforcement officers, community members, NAMI from Memphis, that really helped shape our ability to go back. And we launched the training. When we came back home, though, we knew we had to plan and get a lot of buy-in. And that's part of the steps to make your CIT program be realized to make change in your community. So we actually embarked upon sort of a presentation mission of going to our sheriff and each and every police chief individually, and we educated them about CIT, what it was, and what we wanted to do. And by doing that, they all signed on board and gave their support to work on developing CIT as a program, develop the training, and then to launch it. And so that was our first steering committee. That was our committee that really began to work together to bring this about. So we launched our first training in 2001. And we stayed together as a team, and just sort of fast forwarding some of the work we accomplished through the CIT steering committee, the CIT community, the collaboration, is we did achieve that one of those visions. We did open a central receiving center, a drop-off for law enforcement, where they were in and out of the center within 5 to 10 minutes. And that was back in the early mid-2000s. So we were really excited about that. Because of our excitement and hearing things that were beginning to happen around the state of Florida, we called a meeting with some of the other communities in Florida that were beginning to do CIT. And it started with 13 communities. And we came together to develop a vision for Florida of what CIT was going to look like in our state. And that launched our Florida CIT Coalition. And that started in 2004. Today, this coalition is still strong. It's still going. We have over 50 counties throughout our 67 that come together bi-monthly or every 2 months, I should say, to work on fostering excellence within CIT around Florida, to share ideas and to share resources. So that to me is another example of bringing CIT, the concept, into action, where we're together and we're working on identifying needs, not only in our own community for improvements, but also around the state, and to do that collaboratively. And it's really very exciting and keeps the energy going. Next slide, please. So when we talk about CIT in action, you do have to get started somewhere. And I'm going to say it can start with one person. Every community I've been to, and my own included, it really has been one person that learned about this, and then they began to gather other like-minded, other passionate people. So it's about finding your allies. But getting started really is about people with passion and a really strong desire to want to make a difference in their community. So one person can get started, but find your other allies that are passionate, which will accelerate you working on very tangible things that can help make positive changes in your community. So it's about sitting together. Now, next slide is, okay, so we've gotten started. We've got to build this thing. We've got to build this machine to move things forward in our community. So this is through that cross-system partnership, that bringing those allies, and that cross-system partnership has to be in the inclusion of people with lived experience, because we are there to assist helping those in crisis. So people with lived experience are so powerful to this change and this to the mission and to the collaboration that CIT brings. CIT is a real testament to what can be achieved when we work collaboratively and when we work with intention. This is a journey that you have to stay together and empower others to become involved. So that's a really critical piece for CIT, is you can build it to make changes, but you have to keep feeding CIT, nurturing CIT, in order to keep the ongoing system improvements continuing and to grow. So our work is not done in isolation, but in collaboration with others. And that each of us plays a vital role in the collective efforts to make our community safer, healthier, and more compassionate. So next slide. Ingredients for success. Oh, there are so many, so many. And I always like in CIT and the training, I always sort of throw in this grandma's recipe, how we sort of share and pass things, and everybody contributes something to really, really make the bread, make things very, very good and very robust. But there's many ingredients that make CIT successful. And I know these 4 words aren't all, but to me, they really get at the heart of CIT. It really is about the passion, and with passion is usually the commitment that people will stay with this. It's of course the collaboration, but with that you need good leadership. But really the biggest ingredient for success is the heart that everybody brings to CIT, to their program, and to the aspect of training within their program. Next slide, please. So I chose this umbrella to represent the power of CIT as a community change agent. That's what I've been thinking about more and more. CIT really is a change agent for communities, and you and your CIT is you as a part of it. You're a change agent. Together, we have a shared responsibility to improve the lives of those facing mental health crisis in our communities, and working toward a common goal, ensuring that individuals in crisis receive the help they need when they need it, and in a way that respects their humanity. What I like about CIT as a program, it really gives a framework. It has these wonderful core elements that give a framework. And within that framework, there's a lot of flexibility because no 2 communities look quite the same, but we're all on the same mission with the same vision and with the same goals to make our communities healthier and to give people the supports they need for recovery and for healthy, vibrant lives. So what I love is CIT gives the framework for that coordination and collaboration for system change. CIT really does break down silos because we all come to the table from different parts of the system, and that's when it's an opportunity to break down those silos. We know that many communities will have different kinds of crisis responses, and that's wonderful. Mobile crisis, co-responders, CIT trained officers, EMS, other civilian-led type crisis response. So it's really not a one-size-fits-all. So what better way than through a CIT program, but to coordinate all these various efforts? So we're talking together, we're collaborating, we're strategizing, we're sharing information, we're collecting data, but it's all in a way that we can understand how things are moving in our community, and it keeps us from moving back into our silos. So within a CIT program is a steering committee, and that's an action item, getting people to the table. And this committee is a hub. It's a hub where it allows your group, your community to focus on improvements within the crisis response and with other services beyond the crisis response, but the support services, the treatment services that need to either be built or to continue to strengthen what they offer the community, and to continue to build those relationships to help facilitate the conversations for dealing with complex or working to address and resolve complex issues, and that collective together strategic planning. So the CIT program's mission is to help foster community crisis systems that promote access to care, reduction in engagement with the criminal justice system, and building healthier communities. CIT programs help create a united voice to advocate to our policymakers and our funders for resources to build this better system that promotes someone to call, someone to respond, and some place to go. Next slide, please. So CIT matters, and CIT in action, it's about what you see on this screen. The most important one, though, is CIT in action is about you. CIT matters, CIT is an identity, and CIT, it's your identity. So with that, CIT really is a voice of change, and CIT is a voice of hope. Next slide. I think that's it. So you can go back because I think we're going to do a little bit of a reaction.
Thanks.
So, yep, that's it. It's the CIT in action. And it's a call to action. We're calling everybody to action.
Yes, thank you so much, Michelle. I love everything that you said in there, that we all can be community change agents, and that it is for all of us, right? It is a call to action, guys. So I want us to heed that call. Let me turn it back over to Paul and get reaction from the CIT conference and the folks in the room.
All right, we are back. Thank you so much, Lauren. Look, there's one thing Michelle did not mention. Earlier today, by surprise,
Oh.
Michelle was awarded the Sam Cochran CIT International Champion Award. So love to hear it from Michelle. Man, her lifetime dedication to this work is incredible. So with that in mind, we have a room full of individuals. So instead of our usual panel discussion, we have an open mic in the middle of the room. Sabrina Taylor from City of Phoenix Police Department is there manning the mic, and we're hoping you come up and share some of your thoughts with this group on just how important CIT is, the value, and any thoughts you have around what Michelle said earlier today. So turn it over to the mic there. Thank you, Sabrina.
Yeah, come on up, everybody. If you have a few words to say to the people listening on Zoom, we have Danu here from New York who's going to say a few wonderful words about CIT and 988.
Okay, my name is Danu Sanasi. I'm from New York State. I was attending the 988 calls every month, and I'm a NAMI mommy. And I tell you how I felt the day CIT became, came into effect. July 16, 2022, I was the happiest person. And why was I so happy? Because I'm a family member. Also, I have my loved one, right? When we call, it's a sense of relief that somebody picking up the phone when we call, they know what they're talking about, who are compassionate and empathetic. And it's not somebody who don't know, who have no clue. That was the biggest relief I got, and a place where we can feel safe, whom we can call and talk. That was my biggest relief, and it was a celebration for me, the day 9/8. Thank you.
And now we have Felicia from North Carolina.
Hi, I'm Felicia McPherson from North Carolina, CIT coordinator, and I've been with CIT since 2007. And one of the greatest assets we now have is 988, making sure that people are being heard, not just shuffled here or there, but actually being heard. And we really appreciate having this resource on a national basis. Again, another great CIT conference. Everybody travel safely and see you soon.
All right, Paul, I think everybody else is camera shy, so back to you.
All right. Thank you, Sabrina. Listen, a few other reflections I have here is the emphasis throughout this conference. So many of us are familiar with crisis intervention team training around the nation, but if you see the dedication of these CIT officers, the commitment to do all they can to help those in need get care. And so there's this call to action that I feel here, which is, look, they've done their part for quite a long time now, and this movement continues. And I think CIT is getting stronger each and every year. And at the same time, there is this call to, and we have to have the resources to connect them to that care. So I hope those listening on the call today hear what we heard from Michelle. This is a community partnership, and the community partnership means law enforcement is coming through They are going through training to make sure they can establish ways to meet the needs of individuals going through crisis. And they need resources in that community to connect them so we can all be successful. So thank you so much for the opportunity to join you from the conference. And we may hear from you a little bit later so I can introduce you to this amazing individual, Bo. So thank you so much, Laura.
Thanks, Paul. And I'm not going to let you all off the hook that quickly. Actually, I would love to get some reflections from Sabrina, what this work has meant to her. And Paul, I've got a couple of questions for you, but let's start there. Sabrina, we want to hear from you.
Oh, she's getting her mic going.
All right. Fire away.
What has this work in crisis intervention meant to you?
Oh my gosh. You know, it's the chance to make a difference in the world, right? And to try something and see it make change and make somebody's life better. And I think every time every one of us in this room sees the fruits of our labor, it's fulfilling, it's energizing. And I think Michelle even said it this morning when she was receiving her award, like, this is why we get out of bed in the morning.
And hey, while the camera's there, Laura, I do want to jump up. I hate to give pressure to Steve Michio since he's right there next to her. But look, I think the perspective of those that really have received these services is an important one. What matters? So Steve, I don't know if you can share some of your thoughts there.
Hey, everybody, Steve Michio here. Yeah, the CIT has brought community to our community. I mean, it's been so powerful in having peers and clinicians and providers and police departments working together has just made such an impact on the integration and collaboration of what we try to do and how we try to provide better service for everybody in our communities. So it's just been invaluable, and I'm just so happy to be a part of CIT itself. Thanks, Paul.
Awesome. Thank you, Paul. Thank you, Steve. You know, I would love to hear maybe Sabrina or Steve. You know, we can feel the sense of community, and it's very contagious. And just like Michelle said, you know, this is a call to action. This is our first time really live streaming into a conference. Can you tell us a little bit about the efforts to bring the CIT into the JAM and why it was important to do so?
Oh, I can jump in first, Sabrina, if you want.
Good.
And then here's Sabrina. So look, I will tell you, Laura, I don't think I've ever been to a conference where it feels so much like a family, so united to achieve this same goal. Look, we don't always agree about exactly how to get there, and we have to figure out the best thing. And I will tell you, rural communities got to come up with some really creative solutions, I've heard around here, to make this all happen. But all of that said, what you see is this commitment to, you know, it's really clearly stated by CIT International. I want to read it quickly. It's community partnership to improve responses to mental health crisis. And so the fact that, look, we've been working on things, and I know we're working on a new version of the SAMHSA national guidelines. Many people in here have been trying to figure out something for decades. And when you talk together, it's like they're your brother, your sister, maybe a couple are your second cousin, but this is family here, and it's really a remarkable feeling in this group.
Thank you, Paul. I think the theme of this conference has been family. And, you know, I've had a dream of bringing the jam to the conference because I also love the jam. And for a couple of years, I joined on my laptop. We gave prizes to people who would come into the room with me, and we used my little camera, but we really upgraded. I want to thank our AV department for making this work. I don't know how they did it, but we have these wonderful cameras and this wonderful audio in this huge room.
Well, thank you.
Laura, I think the thing I'd note to everybody is these voices really matter as we evolve systems. Hearing from law enforcement more on what they need as a partnership matters a lot, what works to them. And so I encourage us all to continue to listen to the voices of those individuals in the room now.
Yes, appreciate that so much, Paul and Sabrina. And especially Sabrina, you're getting comments in the chat about your energy. It is so contagious. And just want to thank you for bringing us into the conference. We can feel that energy. And I think, Paul, you said it so wonderfully. We may have different ideas of what it looks like or how to get there, but we're all sharing the same goal. And that is supporting people who are in crisis. And so just thank you all so much. We're going to go back to you guys later in the jam, but now I'm going to turn it over to Dr. Richard McKeon from SAMHSA for a SAMHSA update.
Thank you, Laura. Great to be on today, and what a wonderful session with all of the information about CIT and the connection to the conference going on. That is really great. So appreciated being able to learn more about the CIT model and to have it be playing a prominent role in the jam today. So there are three things I'm going to go over. So first, last week, SAMHSA had a meeting focused on the crisis standards definitions with an eye toward moving toward a SAMHSA National Guidelines 2.0. A lot has been accomplished since the original release of the guidelines back in 2020. I know a number of you on the jam were present in giving important input for that. Also, wanted to remind people that September 8th will be 988 Day. And of course, that is 9/8, at least the first two numbers of 988 aligning with that day. And the purpose is to create a positive buzz around the 988 Suicide and Crisis Lifeline and related activities across the country to raise awareness of 988 in fun and creative ways, and to really have this starting to be an annual tradition. We're encouraging everyone to share what you did for 988 Day on social media using the hashtag 988 Day. And we'll have a digital social media wall collecting everyone's activities. We've had an overwhelming positive response since we put this out into the world, with more than 2,500 people signing up for the activation workshop we hosted on August 12th. And maybe, David, in a few months from now, that can be a trivia question. People are really hungry to share this resource, and we hope we're giving them something to anchor their efforts and messaging too. The 988 Day digital toolkit and everything you need to know for how to participate, including a link to the recorded workshop, can be found on the SAMHSA website, and I'm going to try to put that into the chat. So a lot of great things about 988 Day, and I love the graphic here. No judgment, just help. Finally, let me give you an update on the efforts regarding the implementation of the National Strategy for Suicide Prevention. One of the things the federal project management team that I'm honored to be a part of is doing now is working with the Action Alliance for Suicide Prevention and the Suicide Prevention Resource Center on a monitoring and evaluation plan. And we have been working to develop a logic model and an outcomes framework to try to guide our efforts moving forward. National strategies, including ours, typically have lots of great things in them. But it's really important that they are monitored on an ongoing basis so that course corrections can be made. There are great examples of this in Ireland and Australia. And so we are working on developing that for the United States. So I will stop there. Thank you for the opportunity to give the SAMHSA update on today's jam.
Thank you so much, Richard. Appreciate the leadership that SAMHSA has shown 4988. Of course, this is 988 Lifeline is a SAMHSA program. And as always, just love getting those updates from you. Now I'm going to pivot over to NASHPA, the National Association of State Mental Health Program Directors, and we have Megan Haupt. Megan.
Thank you so much, Laura, and thank you, Richard. As Laura said, SAMHSA and you are doing just such great work on 988 and suicide prevention. It's phenomenal. So thank you so much for that. Wanted to let everyone know that just today, Wednesday, August 28th, the U.S. Surgeon General released the document, Parents Under Pressure, the Surgeon General's Advisory on Mental Health and Well-Being of Parents. Love this advisory. It notes the joys of parenting, the worries of being a parent, including the financial strains, the safety, concerns of children, and all of this in the face of the kind of newer things that parents face related to children and social media, the sense of loneliness around being a parent, but also the culture of comparison, where kids are on social media comparing themselves, parents are on social media comparing themselves, and that parents don't really have that support that they need. And so what I love about this advisory is the notion that by prioritizing the well-being of parents, it helps the well-being of children. And I think we really want to get ahead of that. It helps keep people out of crisis. It helps children stay out of crisis. And so I encourage you to take a look at that advisory. It is now in the chat there. And shifting gears a bit, although related, wanted to announce about the National Dialogues on Behavioral Health. It's a 65th annual conference. This is a gem of a conference. It's being held November 3rd through the 6th in New Orleans at the Renaissance Arts Hotel. It is a great, great conference. And what makes it so great is that there is a theme. In this case, the theme is successful strategies to support individuals with complex needs to improve outcomes. Again, we're looking at ways to keep people out of crisis and really reach those maybe more challenging populations that really involve working across systems. So sessions will include about IDD, traumatic brain injury, substance use, integrating public health and mental health and behavioral health. So there are CEUs available for this, and just encourage you to check it out and register. The information and the website to register are in the chat now. And also with this conference, there is not only presentation, but in-depth dialogue, hence the name, National Dialogues on Behavioral Health. So hope to see you there. Thanks, everybody. Back to you, Laura.
Thanks, Megan. And I will say I had the opportunity to go to the National Dialogues on Behavioral Health Conference, and it is fantastic. It is amazing. So hopefully folks will be able to attend and maybe we can do a live stream into that conference. But moving on, I'm going to turn it over now to Tom Betlock to give us Medicaid front and center. Tom, take us away.
Laura, thanks so much. Hello to everybody. I love being here today with the energy and spirit from the CIT live interaction. It's great. Shout out to Sabrina and Paul for making that happen, and really love the energy. So great to be with you today. We have spent one 5-minute segment a month talking about Medicaid, leveraging Medicaid, partnering and collaborating with Medicaid in terms of looking at Medicaid as a sustainability resource. And so today we're going to expand and we're going to look at resources that are available in terms of thinking about that partnership. And so Medicaid is the ultimate copycat program. You know, states look to other states in terms of what they're doing and how to leverage that. Medicaid rewards plagiarism. We always look to borrow from each of the different states and what type of documentation they have or standards they have. And so we've got tools that we're going to make available as it relates to 3 different areas that I get asked about all the time. And that is contract language. And so here we have a link to what Arizona has in terms of 12 pages of expectations for managed care organizations and what's required to serve all Arizonans in terms of the 3 core components of the crisis system in Arizona. So what are the call center standards? What are the mobile crisis intervention standards? And what are the facility standards as it relates to what's required for those providers and the managed care organizations in providing crisis services to all Arizonans? Medicaid pays for a sizable portion of it. There's other funding sources that are brought in. But here's an example with that link that gets you to 12 pages of standards as it relates to a crisis system in Arizona. Included in there is the expectation that for individuals that are going to a facility, that there be a drop-off time of 15 minutes or less when working with law enforcement. The second question I get asked all the time is, what's available for reporting requirements? And here's some examples of regular reporting requirements that are asked by the state to report out in terms of looking at, again, those 3 core services and the type of information that you would expect. How many calls you're receiving? What's the average speed of answer? What's the average response time for a mobile team? How many individuals are being served within a crisis stabilization facility? So there's a lot of great data that's made available then in terms of the reporting information for how that crisis system is performing. And then finally, and I think one of the most important areas that we get asked about all the time is, well, what should providers do as it relates to billing guidance? And what codes am I using? And how does the state reimburse for each of these different services? And how is that done? And so the state has specific billing guidance for each of the 3 services and the codes that are used. And so that's available in terms of being made out to the system and is used regularly so that providers can bill and receive compensation for this, again, not only from Medicaid, but other funding sources as it might relate to potential block grant dollars or state-only resources as well for populations that may not be served by the Medicaid program. So resources available, share these with your Medicaid program, share these as you're thinking about the standards that you want to have in your system. And again, happy to answer any questions as it relates to this specific example in Arizona, but again, look to use it in other states, and in future discussions around Medicaid upfront, we'll bring forward other examples in terms of what states have done, because we all know that there's different delivery systems that exist in each of our states. So Laura, with that, I'll turn it back to you. Thanks so much.
Thanks, Tom. And I think your last comment there highlighted a comment from Kate in the chat around people move frequently. This can be really confusing than it needs to be. So really appreciate you making it easy, giving us those follow-up documents. And so again, encourage folks to leave in the chat if they have a future example they want to see around Medicaid. So with that, I'm going to bring in Stephanie Hepburn to tell us about this week's Crisis Talk. Stephanie.
Thanks, Laura. And I'm going to bring on Sanvi Aurora. She's the executive director and co-founder of the Youth Power Project. Sanvi, in our interview, you told me you've noticed an increase in normalizing conversations around mental health, but it hasn't come hand in hand with action-oriented and access to care messaging. Can you share what motivated you to reach out to Congress and talk about the resolution?
Absolutely. Thank you so much for having me, Stephanie. And hi, everyone. I'm Saunders. I'm a student at UC Berkeley, and I'm the executive director of the Youth Power Project. And yeah, I think something that I talk about a lot with my peers is just how, obviously, over the last few years, we've destigmatized talking about mental illness. I think a lot of the times, young people are a lot more open with, open about mental illness and open about talking about that with their peers. But I think that at the same time, that's come with almost this normalization of the idea of struggling, this attitude that like, oh, we're all going through something. There's no need, I'm not at a point where I need to seek support or care. And almost like that almost like reinforces this kind of stigma around actually taking action over your mental health, because almost by normalizing or kind of portraying this idea that, your struggle is essentially normal or common, oftentimes makes it hard for people to, or at least amongst my peers, it makes it hard for us to feel like we're in the right place to deserve care, support. So this resolution, it's a Senate resolution, just passed the U.S. Senate over the summer, and it advances the idea that there's a mental health emergency, but also ties in tangible interventions for state and local actors to mitigate this crisis. A lot of us, it's completely youth written, and we've been working on it I've been working on it since high school, so for the last 2 to 3 years, and it's incredibly exciting to get to like work with peers on this. But I think what we're thinking a lot about, especially in a policy context, is that policymakers also similarly advance this notion where they will talk a lot about the declining mental health amongst young people, and use that as a talking point or a selling point. But oftentimes, like the teeth the teeth are stripped out of the policy measures that do end up passing, especially at the federal level, or the holistic or nuanced considerations that you need to be talking about when you're talking about mental health policy aren't included in that conversation. And I think that's because there still is a lot of work to do to discuss the intersection between mental health and your humanity and the rest of you as a person, and especially outside of this setting, but in a policy specific conversation, specifically amongst legislators. So yeah, this resolution is incredibly exciting, and I'm really honored to have had the opportunity to work on it. And and Stephanie covered this lovely article about it as well. So please do check it out. I'm excited to be here.
Thanks, Sanvi. I would just ask if you could share maybe a couple of parts of the resolution that were so important to you. And yeah, people, please go read the article. But if you could share a couple of the points in the resolution that really mattered to you.
Yeah, I think for me personally, like I'm really glad that the resolution ended up passing. First of all, it passed unanimously, which is really exciting in terms of the bipartisan consensus that it establishes around particular mental health interventions. And I'm really excited that it included a line on peer-based models for mental health care. I think that's incredibly important when we're talking about diversity in care, to not just consider who is, again, like leading or operating mental health services in terms of identity-based diversity, but also experience-based diversity. No, there's no one-size-fits-all approach to mental health care, and I think it's really exciting that the resolution advances thinking about novel approaches to mental health outside of what we've traditionally focused on. And I think the second piece that matters to me a lot is there's a line in the resolution that talks about one, like recognizing and approaching policy with the intention of recognizing that mental health and physical health are intertwined. So this is really helpful for like school-based practitioners in terms of evaluating how to provide school-based support for students who might miss school due to mental illness, or might be struggling in school due to mental illness. How to kind of talk about that and not reinforce stigma around mental health by considering it as intertwined with your physical health, but also in establishing certain support systems academically that could be helpful. And the other piece that's kind of tied into that is achieving, I think, higher benchmark for elementary and middle schools that are providing support. I think oftentimes there's still a notion that high school students and college age students are like the ones struggling with mental health. And while yes, like teenagers are struggling with their mental health, a lot of the times these are issues that develop over time, and you can struggle with mental illness at any age, and policy should be developed accordingly.
Yeah, I like that you talked about there's no age minimum. I think that's fantastic. Thanks, Sanvi. I'll pass it back to you, Laura.
Thank you, Stephanie. Thank you, Sanvi. Again, just so encouraged by all the work that is happening with our young people. And again, there is no age minimum or limit here. So we're going to turn it back over to Paul and the folks at the CIT International Conference to get a lived lens experience. Paul, I'll let you do the honors of introducing.
Absolutely. Thank you, Laura. And it really is an honor and a privilege to introduce the 988 Crisis Jammers to this next individual. He happens to be the 2024 CIT International Fred Fries Person with Lived Experience Award recipient. A remarkable guy, Bo. I've really enjoyed getting to know you. So from Miami Beach, Florida, it is Bo Hall. Here you go, bro.
Thank you. CIT International, where y'all at? From the bottom of my heart, thank you. You're looking at someone right here that was chronically homeless back in my hometown of Miami Beach. Wait, am I loud enough for you? I was chronically homeless back in South Beach from the time I was 14 years old to 28 years old. And if it wasn't for the love and the hope and the compassion and support that I received from two strangers, I wouldn't be where I'm at today. These strangers never gave up on me. They never stopped reaching out on me on the streets of South Beach, encouraging me. And after 1 year of engagement, I accepted their help in 2001, Memorial Day weekend, to the Miami Rescue Mission. I would go on and live in the Miami Rescue Mission for 3 years. Do you hear me? For 3 years, I lived in the shelter voluntarily. And in those 3 years, I got the support, the recovery, the treatment that I desperately needed. In those 3 years, I found meaning and purpose in my life. In those 3 years, I would go back to school, obtain my education in shelter, go on to college, Miami-Dade College, and then I'll graduate as an EMT paramedic. The very same day I graduated, I was offered a position back in my hometown with the newly created City of Miami Beach Homeless Outreach Department, 2004. I would accept that. I would accept that. Returning back to my same streets, the very same blocks and alleyways and beaches that I slept at, that I was dirty for weeks and months, wearing the same clothing for months, the same underwears. Like I said yesterday to the class, same underwears until they got crusty. I was that same person eating out of garbage cans. I was that same person covered in feces and urine. I was so gone, I didn't even care about taking a bath or getting cleaned up. Do you hear me? I was that same person that overdosed twice and would return back on the block and do the same thing over again. I was that same person that nearly took my life on top of a roof. And I was that same person back when I was homeless. There wasn't any help for us in those years in South Beach. I would take that homeless outreach position and would go on from 2004 to 2018, rescuing thousands of lives with an amazing team alongside me. In 2018, hear this. In 2018, I was brought over to the Miami Beach Police Department, the same police department I used to get locked up in. I was brought over there and offered the first ever position with the Homeless Resource Unit, Miami Beach's elite Homeless Resource Unit, formed back in 2012. I've worked with many of these officers even before that unit was formed, and they brought me over and offered me another opportunity of a lifetime. And you know what that was? To be the only formerly homeless peer specialists working with a team of 4 officers and 1 sergeant for the Miami Beach Police Department. Today, I'm employed with the Miami Beach Police Department. Hold up. I have one of my homeless resource officers here. She's right there in the purple. Homeless resource officer, Melissa Rosa. Let's give it up for her one time. And for the past 6 years, since 2018, I've been with this amazing team. And what we do is we go out to the streets of Miami Beach every day. We meet our most vulnerable where they're at. Throughout COVID, we didn't stop. We was out there throughout COVID. That's it for now, man.
So
Thank you.
Bo is an amazing, don't leave me, Bo. I know we're about out of time on the jam, so thank you so much for having us. But I will tell you, Bo is also a living example of how law enforcement and mental health services come together.
That's right.
In engaging peers and doing this work. So it's been remarkable, Bo. Thank you so much for having us, and thank you, Laura.
Thank you, Bo. Thank you, Paul. Wonderful testimony. Thank you for sharing. And I also want to note for folks in that room, Amanda Miller from Vibrant's Crisis Continuum Department is there in that room, and please do speak to her. She was also featured in this Ernie and Joe Crisis Cops documentary, and very close still with the participants. So please do make sure you all are speaking with her. We want to get that feedback as Vibrant and figure out how we can improve the crisis continuum. But for next week, episode 188, we've got practical uses of AI. This is a conversation that always gets folks talking with Brad Pendergraph. So make sure you join us next Wednesday at noon Eastern. We will see you there. Thank you so much. Have a great day.